Hi there, my name is Carmel. I'm joining you from Payne, BC today on the unceded territories of the Squamish, Musqueam, and Tsleil-Waututh people. Thank you for joining us today on our webinar regarding medicinal cannabis and chronic pain. This webinar is brought to you today by Payne, BC and our partner for today, which is Perceive MD. Today's presentation will be provided by Amanda Bellemore, who is the clinical director of Perceive MD. Before we get started today, I just want to go through some housekeeping for today's session. So the chat is disabled, and please use the Q&A button at the bottom of your screen if you have any questions related to today's webinar presentation. These questions will all be read out anonymously because we will be recording this session. So with that being said, our recording will be completed after the session. We will send a link to all participants of that recording once it is processed and published on our Payne BC YouTube page. And with that being said, all of our questions that are going to be read out will be read anonymously to protect your privacy. With that being said, I'm going to pass things on to Amanda, and just want to say thank you so much for attending, and that's all I'll say for now. And pass things on to Amanda. Thank you so much.
So the cannabis plant, it's an annual plant. That means that it completes its life cycle within a single year. And it's dioecious, so it has male and female flowers on separate plants. Some of you may be familiar with the different strains or species of cannabis. So there's Cannabis sativa and Cannabis indica. They're all part of the Cannabaceae plant family. And we'll get into like a little bit more of that later. But cannabis has these tiny little hairs. We call them trichomes. And they're found on the female plants. And those trichomes, they produce the resinous oils, and this is where the medicine is in the plant. These trichomes produce over 700 chemical compounds. So here's a little close-up picture of the cannabis plant, and you can see those tiny little white hairs I was talking about. So those are the trichomes. If we were to zoom in a little bit further, you can see that they kind of look like mushrooms. They're little translucent mushrooms-shaped glands. And again, they secrete resin, and that's where we are going to find the medicinal cannabinoids and terpenes. So over 100 cannabinoids, over 200 terpenes produced from the plant. So how does cannabis work in the body? Well, it interacts with our body via the endocannabinoid system. And this system was actually named after cannabis because that's how it was discovered. Endo means within, so within the body. The endocannabinoid system, it's involved in regulating a variety of physiological and cognitive processes, including fertility, pregnancy, pre- and postnatal development, appetite, pain sensation, mood, and memory. And the endocannabinoid system has cannabinoid receptors, and they're widely distributed throughout the body. We've named them CB1 receptors and CB2. You can see a little graphic there that kind of gives you a visual of how we believe it to work with like a lock and key function. CB1 receptors mainly found within the brain and central nervous system, but it can be found in other tissues as well. Where the CB2 receptors, those are mainly found peripherally. So, for example, in immunological tissues, so like the immune system. Now, the phytocannabinoids, so phyto meaning plant-derived, the phytocannabinoids from cannabis, which are THC and CBD, we'll get into that next. These compounds mimic endocannabinoids, so cannabinoids that we make within our body. And so these phytocannabinoids are binding with the cannabinoid receptors, CB1, CB2, and causing effects within the body. So let's get into that. THC is probably the most well-known compound phytocannabinoid of medical cannabis because it's what gives us the high, the psychotropic effects. So what does that entail? It can cause euphoria, it can impact reaction time, it interacts with our situational awareness and perception, so it can impair our cognition and short-term memory. It also has behavioral effects and can, for some people, cause anxiety. It's antiemetic, which means it eases vomiting and nausea. Analgesic, so pain relieving. It's an appetite stimulant and anti-inflammatory. THC risks and benefits. So there are a couple of risks to know about THC consumption. So THC can trigger psychosis. This is typically seen in those with family or personal history of psychotic episodes or mental health. It's also important to note that the studies that have shown this are not always studying the same products, which is what that heterogeneous product studies means. And another risk that is more recently found in a study was that smoking THC may increase the risk for heart attack, stroke, and heart failure. The possible medical benefits of THC include chronic pain, nausea, insomnia, anorexia and poor appetite, stress, glaucoma, spasticity, so like in MS, Parkinson's disease and Huntington's, and as well as IBD and cancer. Some of the possible short-term side effects of a THC include anxiety, fatigue, drowsiness, dizziness, dysphoria, so like a profound sense of unhappiness, distress, or indifference, reduced coordination and ataxia, which would be a full loss of full control of bodily movements. There's sedation, dry mouth, visual disturbances, decreased tear production and blink rate, so dry eyes, tachycardia, which would be abnormally rapid heart rate, and possibly bradycardia, which would be a abnormally slow heart rate, and that's found in chronic users. A big question about THC is about cannabis in general is the addiction risk. So we just want to break down what addiction means in this case. So for THC, when we look at tolerance, which means like the need for increasing doses to obtain the same effect, there is evidence based on recreational users, so those that are using high THC amounts and usually smoking, that there is a tolerance where you would need to take more THC to get the same effects. And the THC use can lead to tolerance in the effects of the euphoria and psychoactivity and the cardiovascular effects, however, not seen in pain and spasticity. And it's important to note that this tolerance can be reversed by stopping THC, and it's usually done within 28 days that can be reversed. Another piece around addiction would be withdrawal, like will there be withdrawal symptoms by stopping THC? So this can occur with heavy THC use, and it's usually within 1 to 2 days of stopping that you may notice like irritability, craving, THC, anxiety, an upset stomach, loss of appetite, sweating, disturbed sleep, and the likelihood of withdrawal symptoms after stopping THC directly correlates with the amount that has been used. So there's a higher risk with the higher amount of THC used. Another piece around addiction would be physical dependence. So we do see mild symptoms for THC. The body does adapt to experience drug-specific withdrawal symptoms if the drug is stopped, rapidly reduced, or reversed. And then the last piece around addiction is the psychological dependence. So we do there is something called cannabis use disorder, and so we do see that there is a cumulative risk for rec users, where 33 to 50% of rec users using daily high THC smoked meet the criteria for this cannabis use disorder. And I'd like to lastly just have and then the risk factors for this, sorry, would be younger age of initial use, pre-existing psychiatric issues, low socioeconomic status, male users, and coexisting other substance use disorders. So that's a little information about THC, and now CBD, another cannabinoid, in THC. I'd like to go into detail about that. And CBD is not psychoactive. So when you're taking CBD, you will not get high, essentially. It produces many effects through multiple pathways. So not only does it work on the CB2 receptors that we talked about within the endocannabinoid system, it also interacts with other systems and receptors in the body, for example, serotonin receptors. And a really cool thing about CBD is that it can counter the THC effects of psychoactivity, appetite, and tachycardia. So it tames THC, if you will. What are the risks of CBD? It may interact with certain medications. So that's really the only known real risk of CBD at this point. It's relatively safe in terms of its use. And what are the possible medical benefits with CBD? We're seeing benefit with epilepsy, inflammation, pain, spasm and tremors, anxiety, insomnia, nausea, addiction, and treatment of psychosis. Now, there are some short-term side effects with CBD that patients do report, so somnolence or sleepiness, diarrhea, which honestly, from working with patients, I find that a lot of people are reacting to the oil itself and not necessarily CBD, so that's a question there. Decreased appetite, fatigue, vomiting, fever, and lethargy are all possible short-term side effects of CBD. So there's no evidence of tolerance to CBD, and there's no documented risk of addiction or withdrawal symptoms with CBD. In actuality, there's some studies that are suggesting the role of CBD as an intervention for addiction. So for other addictions, for example, cocaine, opiates, and other psychostimulants as well. So all in all, it's all about the ratio. THC and CBD work together synergistically. We call it the entourage effect. All of the compounds within the plant work together in harmony. THC increases the effectiveness of CBD, so we do actually like to have a little bit of THC within the product or taken as well alongside CBD. And CBD, as I mentioned, reduces the negative side effects of THC. So they do work really well together. And so that I always like to stress the importance of looking at a whole plant product, where you're getting a whole plant extract, essentially. So it's retaining the full plant profile. That's not to say that an isolate or a distillate, which is just the compound of CBD and or THC extracted into a medium, that it's not to say that that isn't effective, because they are, of course, CBD and THC effective on their own. However, the benefits of having a whole plant product is shown through this entourage effect. And we'll get into a little bit more about terpenes later, but just in itself, the cannabinoids interact synergistically. And yeah, so let's get into a little bit of how medical cannabis is consumed. So there's quite a few different types of products out there you'll see on the market. So methods of consumption include a sublingual, whether that's an oil or a spray or a strip. They're all kind of included in that category. And these ones, you're going to see an onset of effects within 30 minutes, and they peak within 2 hours, and usually last in the 8 to 12 hour range. And so because the peak is after 2 hours, it's good to wait at least that amount of time between doses. So that's sublingual, and then another option would be edible cannabis. So that may include soft gels or gummies. There's chocolates, lots of choices these days. And the onset for that is typically a little bit longer. It can be as quick as 30 minutes up to 2 hours. It's variable in terms of how it will peak. It is affected by like how much you've eaten recently and that sort of thing. So it's good to wait at least 3 hours before you redose if you're taking edible cannabis. Another method of consumption is vaporizing. So that could be either heating a dried product in like a dried herb vaporizer, or there are oil versions of vape pens on the market as well. That would be, of course, inhaling and holding for 3 to 5 seconds and wait at least 5 minutes between doses. And these ones are going to have a almost immediate onset and a much shorter time that the effects are lasting for you. Now, the least favored method is smoking cannabis, and that would include like joints. It may also include like a water bong, and that would be preferable, or of course, as I mentioned, a dried herb vaporizer, because that would limit your exposure to the tar, the carbon monoxide, and other carcinogens you receive via smoking. However, patients do report a higher high essentially with smoking cannabis, where you do feel the effects of THC quite a bit more strongly and immediately by smoking. Other products that you might see, there's lots of topicals out there, newly on the market. We find suppositories, patches. So those are some products that you might also be aware of on the market. Okay, so cannabis and pain. I'd like to just review a little bit about pain. So there's acute pain, sudden onset, less than, I think that's supposed to say 3 months, less than 3 months, and could be due to sprains, broken bones, bruises, that sort of thing. Chronic pain is ongoing, for more than 3 months, and may have a specific or not specific cause. Nociceptive pain is physical pain due to the body being harmed. So, for example, fractures, bruises, burns, arthritis, sprains. Neuropathic pain, shooting pain, burning pain, numbness. This is physical pain due to damage to the body's neurological system. So cannabis has not been found to be effective for acute pain. And of course, the topic of this webinar is chronic pain. And so that's where we do see the benefit with cannabis. And so the endocannabinoid system does play an important role in modulation of nociceptive and pain states via 3 levels. There's the brain level. And so it mediates emotional response to pain, which I find super fascinating. It essentially turns down the volume of signals that are coming into the brain. The spinal cord level, so reduces pain signals that reach the brain, and peripherally, so reducing inflammation and hyperalgesic responses before they even reach the spinal cord. So clinical studies on cannabis and pain are varied when it comes to products or cannabinoids used, whether they're synthetic products or natural cannabis-derived products, varied doses and methods of consumption. So it's hard to draw conclusions from the clinical studies that are currently available, but general findings do suggest that cannabis has at least a moderate effect on reducing chronic pain levels for most patients. So treating with pain, what we have the most clinical evidence to date for neuropathic pain, pain and spasticity in MS, and cancer-related pain. And so it's important to just note that the clinical studies on cannabis are still playing catch up. As I mentioned, the prohibition of cannabis eliminated all of the scientific use of it as well. So for all of those years, we were not able to study the plant and its medicinal uses, even though for so long it had been being used medicinally. So we are still playing catch up with the current research. So the current research that's out there may not provide a full picture of what cannabis is capable of. And so we do have some limited or mixed clinical evidence on headaches, migraines, arthritis, musculoskeletal pain, IBS, fibromyalgia, menstrual cramps, but a lot of anecdotal findings for these as well. So I'd like to stress that cannabis is a plant medicine, so it's a lot different than pharmaceuticals. Just as our individual bodies are beautifully complex and unique, so are cannabis strains. And cannabis is not a quick fix medicine, and nor is it a one-size-fits-all medicine. So what may work for one patient with arthritis may not work for another. And overall, the effects may not be immediate. So it can be helpful to have guidance when selecting products to minimize trial and error. Effects, again, may not be felt immediately, especially with CBD, as results are cumulative and dose dependent. It's all about finding the dose and cannabinoid combination that works for you, which can take time and patience. I do want to do a quick little note about cannabis and opioids, which because research is suggesting that there is an opioid sparing effect where cannabis, mainly THC, enhances the pain relieving effects of opioids. So this is really interesting to know because it can make opioids safer by widening the therapeutic window. CBD can reduce the cravings for opioids, and as I mentioned, it can help with addiction as well. And so both THC and CBD help relieve symptoms of opioid withdrawal, such as anxiety, pain, nausea, cramping, low appetite, insomnia. It can be safe. Cannabis can be safer and lower risk of dependence and problematic use than other harm reduction methods like methadone and Suboxone. But it also can be used in combination with these to enhance the benefits and support titrating down opiates. Important caution, however, inhaled THC should be limited with opioid use. When used chronically and at higher concentrations, THC can increase the rewarding properties of opioids. I'd love to share a few details of some studies that around opioids and cannabis use. There was a 2016 survey of medical cannabis patients conducted by Dr. Dustin Sulak. And they studied 542 opioid users. 39% stopped opioids and 39% stopped opioids and reduced their dosage. It is also found that adding cannabis when patients are using opioids reduced pain by 40% and improved quality of life in 80%. There was also an observational study by one of the licensed producers of medical cannabis products called Tilray, the Tilray Observational Patient Study. It took place at 21 medical clinics throughout Canada, and it included 1,145 patients. The baseline opioid use was reported by 28% of patients, and after 6 months, it dropped to 11%. Daily opioid use went from 152 milligrams of morphine milligram equivalent to 32.2. So a 78% reduction in mean morphine milligram equivalent. So I did receive some questions that were submitted by you all ahead of time. And I know there's a lot of questions around specifics of like what strains or products and what do I take for my pain. Now, as I mentioned, it's such an individual experience, and it's hard to make generalized recommendations. However, I wanted to focus on some terpenes that you could consider for pain management, because as I could mention strains. However, sativas and indicas, these days, the strain type is more or less irrelevant. There's been so much hybridization that the names are really just placeholders at this point, and really indica strains are typically considered to be more of like a body high. That's what you'll hear, where sativas are more of like a head high, where cognitive effects versus felt in the body. And that's generally true, but when we're talking about these effects, we're actually really talking about the terpenes that are included in the strains. Because the terpenes are essentially essential oils, or what give the plant the aroma. And I like to think of it as that they direct the effects of the THC and CBD. So if THC and CBD were the bus, the terpenes are the bus driver. And so terpenes are ubiquitous in nature. They're not just found in medical cannabis, or they're found in every plant almost. And so I made a list here of some that you might like to consider for pain management. And so focusing on strains that have higher concentrations of these terpenes would be beneficial. So in strains or products. So let's get into a few examples. Caryophyllene, also found in, I believe, cloves. It has analgesic and anti-inflammatory benefits, and may want to especially consider for muscle spasms or if there's concurrent insomnia. Myrcene is a muscle relaxant and analgesic. It's shown to be better combined with THC. So if there's THC as well in the regimen, that would be it would have more of that effect. Pinene reduces inflammation. I would consider it for migraines and neuropathic pain. I do want to caution with PTSD. It has effects on memory, and it actually can help combat short-term memory impairment associated with THC. So I would just like to put that caution there for patients with PTSD to just keep that in mind. If you're noticing negative effects with a certain strain and it's high in pinene, that might be the reason. Linalool blocks pain centrally and peripherally. I would consider for concurrent insomnia and or anxiety and depression. Linalool is commonly found in lavender. Humulene, it's anti-inflammatory and analgesic. Limonene, it's not necessarily known for pain relief, but it is beneficial for anti-inflammatory and stress relieving effects. So if there's concurrent anxiety and depression, I would really consider that as one as well. So some questions that I typically get around medical cannabis is what's the cost? So the cost for products varies so much. And so for an oil, for example, I like to break it down per milligram of CBD and THC, because that's really the only way to compare products. And so there's such a big range from 4 cents all the way up to 10 cents a milligram for CBD and 5 cents to 16 in THC. And of course, capsules, you do pay a bit more for the capsules because there's a bit more processing involved. So they range from 7 to 18 cents for CBD, 11 to 20 for THC. An example of a product, say a 1500 milligram oil on average, we'll say is $85. And with a 25 milligram per day use, that would give you 60 days worth of product. So that kind of gives you a rough outline of what things may cost. However, when you do go through the medical system, they do have compassionate programs. So potentially 10 to 30% off for those that qualify. That would be based off income. So if you are receiving federal or provincial social assistance, you would guarantee to qualify for that. Typically, the income levels, I believe, would be under either 30 or 40,000. I think it's 40,000 now, depending on the licensed producer. They do vary in their requirements for that, but most of them do have a compassionate pricing program. And most do have other discount programs. So veterans do have a special program through Veterans Affairs. Veterans Affairs Canada covers up to 3 grams per day for veterans. Other discounts that may be available through licensed producers include for first responders, seniors, and pediatrics. Another benefit of going through medical cannabis is, of course, the medical supervision. So helping with dosing, monitoring side effects, and most important, I would think, is the drug interactions. So if you are taking, I don't think I stressed this earlier, if you are taking other pharmaceutical medications, both THC and CBD are known to have interactions with pharmaceuticals. They work on the main liver metabolism pathway, and so there are quite a number of drugs that do have interactions, and mostly that just means that we have to monitor for these effects. It can usually be safely used, but some of them may be dose dependent, where only small doses are allowed. So it's important to speak with your doctor or pharmacist regarding that if you are taking medications. Medical cannabis also, for some people, if you have extended medical coverage, it would be plan specific, but the licensed producers, some even are direct billing now. So I'd look into that if you do have extended medical coverage through your employer or otherwise, as medical cannabis may be covered. Again, plan specific, and I think there are some now that are covering, even if you just have the medical document, but there are some that are still only covering if your medical document is for the main 3 researched conditions of neuropathic pain, spasticity due to MS, and cancer-related pain. So it would just be looking into and speaking with your insurance provider for that. Medical cannabis is also a tax-deductible medical expense as well, so that's good to know. I think I'll leave it at that, though. That's all I have planned, because I'm sure there are questions, and I'd love to get into that.
Thank you, Amanda. Yes, we do have some questions in the Q&A. So I can just read those out to you if you'd like, or if you want to read them out, whatever you prefer.
Yeah, I can read them here. I see them. Is the risk for heart attack, stroke, etc. only related to smoking THC? Yes, for the study that, if I can recall, it was related to it was looking at high THC users, and correlating that with heart attack, stroke, etc. So I would like to say yes with that, and the risk is definitely lower consuming it with an edible or oil, that sort of thing. I'm curious what high THC means. I personally find the THC concentration sold in most stores is way too high. 20% seems to be the minimum in flower. What is high THC in studies? Great question. That brings me back to something that I didn't quite mention, but like you said, the THC concentration is so high these days, and it's important to note that the cannabis never used to have such high THC content. It's been bred over the generations for THC because really it was only being used recreationally on the gray market. So people wanted to get high. And so we're finding that all these strains are really high in THC with minimal minor cannabinoids. There's including CBD, but there's also CBN, CBG, and others. So yeah, we do see that the THC concentration is high. When I'm speaking about high THC, I'm not necessarily talking about the concentration. I'm more speaking to the milligram amount, like how much THC are you consuming? So if I were to take a small amount of a 20% THC, I'm gonna get a certain milligram amount of THC versus if I were to take like a higher dose. So I don't honestly know what the parameters are, like where the threshold is for high THC in terms of milligram amount. But when we're speaking about high THC use, we're talking about chronic THC users that are consuming daily, usually smoking, and regularly throughout the day, consistent use throughout the day in high doses. So essentially you're using THC to the point of feeling high and maintaining that daily for a very long time. So I hope that answers that question. Okay. CBD also extends the efficacy of THC due to the entourage effect. Using CBD in greater dosage than the THC, i.e. 2 to 1, allows you to be less THC but get the great. Yeah, exactly. So that's more, I don't think that was a question, but definitely something I didn't quite stress was that we are looking at the ratio, correct? So as I mentioned, THC does help to improve the effects of CBD. So we do like to have small amounts. And you'll notice when you purchase a CBD product, there's still going to be a warning label of THC because they all do have a minor amount of THC. Usually the ratios are like a 1 to 20 or a 1 to 25. Or like a 2 to 50, that sort of thing. So you're always going to see little amounts. If you cannot tolerate THC at all, there are isolates where there's absolutely no THC. So that's something important to note too. But again, it's going back to finding the ratio that works for you. So some people can tolerate up to like a 1-to-1 ratio. So where you're having an equal amount of THC and CBD, and you're not feeling any negative effects of the THC, which is great. Some people are more sensitive to THC, and so a 1-to-4 ratio, like a 5 to 20 product, may be too much. So this is where it gets into, again, working with your individual constitution and finding what ratio works best for you and in your pain. Okay. Okay, what research do you base that cannabis cannot be effective with acute pain? I have used 3 times now for acute pain and experience due to injury, chemotherapy. Great. I couldn't use the opioid prescription I was given to vomiting. It took a bit to get the right dosages, but I was able to recover with higher CBD dosages. Great. I love that was effective for you. It was where I got that information was off of a physician summary for medical cannabis. I didn't mean to necessarily say that it wouldn't work at all, but there is some evidence that for some people it works. It's just that it's not the main what I want to say. It's not showing the same effectiveness, if you will, as we're seeing with chronic pain. So there really isn't, I would say, either enough evidence to really make a blanket statement about that either. So with all of cannabis research, again, we need a lot more to catch up. I'm hesitant to use cannabis as I have brain fog and issues with dizziness. Would cannabis affect these and make things in my brain worse? Good question. For you personally, I would recommend starting with CBD only and working with that. So most patients, so again, I work at a clinic, and most patients that are coming in are looking for to not get high. They don't want to get high, and most people are looking for CBD, and that's typically where people are starting. And I think that to start with that would be the best way to go. And then from there, evaluating how effective that is and whether or not additional THC is required. Okay, how does synthetic medication system fit into pain? Okay, sorry, I didn't say that. I kind of mumbled that. How does the synthetic medication Sesamet fit in for pain management? To be honest, I'm not familiar with that medication myself, but it would be important to note, I'm just looking here, used in chemotherapy to treat severe nausea. So when I know for a fact that chemo drugs in general do have interactions with cannabis. I'm not a pharmacist, but I do know that, and so I know it would be important to discuss that with your doctor and more likely a pharmacist as well if you were looking to fit in if you were taking that medication and wanting to take with cannabis. Why are oils liquid measured in milligrams, not milliliters? Great question. Oh, this is like the $1 million question. It's so confusing for people sometimes because there's so many numbers and so many symbols, and yeah. So, okay, let me make sure I can say this as clearly as possible. So your bottle of liquid oil is obviously going to have a milliliter amount. So most of the products are going to be, we'll say like 30 milliliters or 50 milliliters, more or less irrelevant how much oil is actually in the actual bottle, unless you're calculating like the cost of it. When it comes to the dosage has to be labeled. So you'll notice on the labels that it's in like milligram per gram. So all of the liquid oils have what's called an equivalency factor. So it is equivalent to how much grams of dried cannabis, essentially. So that doesn't really have to do with your dose, but more so just when you're ordering through a medical company, it's to do with your allowance, essentially. So medical cannabis, you have a certain, you're allowed a certain amount of dried cannabis per day. And so these oils have an equivalency factor to factor into that. The dosage is also listed in milligrams per grams, and that is Health Canada. That is 100% their regulations and how it has to be labeled that way. And so it usually does factor out when you're looking at the actual I wish I had a little picture to show you guys. If you're looking at the milligrams per gram, it more or less is equivalent to the milligrams per milliliter. So if I were to take 1 milliliter of oil, how many milligrams of CBD and or THC am I getting? So, for example, we'll say that it's a 25 milligram per mil oil. That means that if I'm taking 1 milliliter of oil, I'm getting 25 milligrams of CBD. I hope that's clear. Okay. How can I buy an oil product that has a specific terpene in it? I would like to buy something higher in pine. Great question. If you're looking in the recreational market, I'm not familiar, like each store would be different, and I don't know if they like show you those details. When I come from the medical side, and like when I'm looking at the medical products on licensed producers' websites, most of them, well, the products that are full spectrum, those that contain the full plant profile, they retain the terpenes, essentially is what we're referring to here. They're going to list the terpene percentages typically. And so you'll be able to see like kind of what the amounts are for those. And so, yeah, I would focus on looking for products that are full spectrum and are giving you that information. If they're not giving you that information, they're likely not full spectrum. And so the terpene, and or the terpene content within the product is negligible, where like you're not going to be seeing the effects from that. I'll point out here as well, since it's relevant, that you can purchase, it's not through the medical cannabis system at all, but there are companies that do sell just specific terpenes. So you can purchase terpenes as well. I'm not going to go into any of that today, but there are that is something that is available if you were looking to focus on a certain terpene as well. So yeah. Also, just a thought, those that are like have an aversion to the taste of cannabis, if you're buying a full spectrum oil, like those are the ones that are going to be more likely to have the taste as well. So for some people, that's not like some people just can't tolerate it. So if that's you, I would just recommend maybe focusing on a capsule or an edible version where you're not going to have that taste. So yeah, just thought I'd point that out. How do you apply for medical cannabis? My family doctor is anti-cannabis. So sorry to hear that. I would look for a cannabis clinic. I know there's quite a few. We're always accepting patients, but if you're looking for a medical cannabis clinic, just make sure that I know for a fact that it can be done without charge to the patient. So I don't know if there are still clinics that are charging patients, but just be mindful of that. If they are charging, make sure that you're getting something for the service that you feel is worthy of being charged, because a doctor should not be charging for medical cannabis prescriptions. So just be mindful of that, but do a search. And if you wanted to reach out, I'm happy to set you up with us. What is the difference from full spectrum and broad spectrum cannabis products? Ooh, that's a good question. Okay. So full spectrum cannabis, as I said, was products that are going to be a full plant profile. So they're retaining the whole plant extract, essentially. Broad spectrum, I'd be mindful as well, because I feel like a lot of people use this interchangeably. Broad spectrum is similar. And I'm trying to think if they're really what the real difference would be. I know that there is, and I'm blanking here, but let me see if I can find the definition that somebody recently was talking about, because we did have this question. Essentially, here we go. Let's see. You know what? I don't know if I have an answer, to be honest. I thought I might, but I would just pay attention to other details that are given with the product. So if they're because I know for a fact that some people use them interchangeably. So if you are looking at the details of the product and they're showing you that they do have a terpene profile and all of that, I would consider it to be the same. And if you want to email me, I can try and find a more specific answer for that as well. So sorry, I'm not able to think about what that might look like at this time. How can you know you are getting the best product? Are suppliers regulated? Great question. Yes, all suppliers are regulated. And I forgot to mention this when I talked about medical versus recreational. So all products on the Canadian market, whether it's in a recreational store that you find on the street, or whether you're ordering through a medical licensed producer, they're all regulated by Health Canada. So they all have the same parameters when it comes to the quality. So yes. Okay. We have a question about the difference between CBG and CBN. So yeah, I can go into a little bit of that. So these are kind of newer on the market. I know that there are quite a number of new products coming out these days with CBN and CBG as well. So thanks for the question, because that's important. So CBG, well, we'll start with CBG, sure. I think CBN is a little bit more popular, but CBG is shown to be neuroprotective and neurogenic, meaning that it would promote the growth of new nerves. It's shown to be sedative, anti-inflammatory, antibacterial, and microbial. So it can be useful in the treatment of anxiety, depression, IBD. It's shown to have gastroprotective effects. So for inflammatory bowel disease might be useful. Glaucoma and autoimmune disorders, spasms, tremors, tics. It's antispasmodic as well. So for that. And neurodegenerative conditions as well. So relating back to the neuroprotective and neurogenic effects. And then for CBN, I think you'll find more products these days with CBN than CBG, but CBG is up and coming. CBN, very mildly psychoactive, around like 10 times less than THC, but it does have a little bit of psychoactivity to it. And CBN is sedative. So that is, you're going to find a lot of products with CBN in it are marketed as like a nighttime or sleep product. And it's especially useful for sleep disorders when you're co-administering it with CBD and or THC. And it can also be anti-inflammatory, so it can be useful in pain, glaucoma, autoimmune conditions, and some cancers as well, as it's shown to be pro-apoptotic. So it can help with cell death, stimulating that. Yeah, I hope that helps.
I know we're getting close to time here, so we probably have a little bit of time maybe for one more question or so before we wrap up. I also just want to answer some questions about today's recording. So this is being recorded, and we are going to be having this recording on our YouTube page in due time. So it will be available to you, and we will also be sending the link to all registrants for that YouTube video once it's up. Amanda, one thing I wanted to ask you, would you be comfortable if we shared your slides with participants?
Oh, yeah, absolutely. I'm happy to share the slides with you, and like I'm happy to share my contact information if because I know I didn't get to all the questions. So if I didn't answer your question, I'm more than happy to answer it if you want to email me, so I can give you my email as well. Yeah, so we'll share that.
Awesome. And just one more thing I want to add for, specific, condition-specific questions around chronic pain and cannabis, best advice to speak with your doctor or your pharmacist to make sure that, when things like interactions and things like that, those more specific questions can be answered by your healthcare provider.
Yes, absolutely. I specifically didn't recommend any dosages because it is super important to talk to your doctor, especially if you're taking medications. So yeah, I'll just leave it at that and do speak with a pharmacist and or doctor as well. Do we have time for one more question?
I think we do. Yeah.
Okay. Let's see. Do you want to pick one?
How can we support and be involved in cannabis research? I think that's a really cool one.
Oh, that's a good one. How can we support and be involved in cannabis research? I think there is something to I think there's a website that you can search for like studies. I don't know if it's in Canada or not. They might have one now. But some licensed producers do do clinical studies. So sometimes looking at that, I'm not sure if there are any active ones right now, but I'll just say like Perceive MD is a research-based clinic. So we do work with collecting stuff like that. So, you know, if that's interesting to you, then you could support that way. But in terms of cannabis use research, yeah, I would just do some searches for either like observational studies and that sort of thing. I'd have to look into it. I know I found it before, but I'd have to look into it to find I think if you go through, oh, it's coming back, MAPS. I think MAPS has I forget what the acronym stands for, I'm blanking right now, but if you look into the MAPS Canada website, they sometimes list, it wouldn't be specific for cannabis, but they do sometimes have lists of ongoing clinical trials and so that sort of thing for different for different things, and that may have cannabis. So that might be a way to go if that's interesting to you.
And Kimberly's included a link to maps.org in the chat, which we will also include in our follow-up email. I just want to say, so sorry we couldn't get to everyone's questions. We had so many questions, which shows that there's lots and lots of people wanting more information. So I just want to say thank you so much, Amanda, for your knowledge and your time. It's been very informative, and I hope that everybody has found a lot of benefits to this webinar as well.
Thanks for having me. And yeah, I welcome anybody to reach out. I'm happy to answer more questions.
Wonderful. Thank you so much, Amanda. And again, just to follow up on our housekeeping, this session is being recorded and will be distributed once we have it published on our YouTube channel. And we will provide also information to get in touch with Amanda and Perceive MD in our follow-up email to all participants. I want to thank everybody here for coming today, and I hope you have a wonderful rest of your weekend.